Hi everyone, my name is Haddy and I'm a journalist and communications specialist. I believe that as Africans, we should be in charge of every narrative coming out of Africa. We have a lot of positive stories to tell and share with the world, and I'm determined to use my platform to make that a reality. This is why I've teamed up with the Fata Network to bring you a brand new show, Stories from the Continent, every Saturday at 4 p.m. Do make sure you join us. There will be lots of fun, informative and impactful conversation. Hi everyone, my name is Haddy and I'm a journalist and communications specialist. I believe that as Africans, we should be in charge of every narrative coming out of Africa. We have a lot of positive stories to tell and share with the world, and I'm determined to use my platform to make that a reality. This is why I've teamed up with the Fata Network to bring you a brand new show, Stories from the Continent, every Saturday at 4 p.m. Do make sure you join us. There will be lots of fun, informative and impactful conversation. Hello everyone, Assalamu alaikum and welcome to Stories from the Continent. My name is Haddy and today we speak on a key subject when it comes to the African continent, maternal deaths. To put things into perspective a little bit, in developed countries, the maternal death rates among women is just 1%. The other 99% or 500,000 women a year die in developing countries, mainly sub-Saharan Africa. In the Gambia, deaths are ranked amongst the highest in all of Africa and recorded at 1,050 out of every 100,000 births. Those figures were in 2005. To find out what's happening now and how we can prevent it, I'm joined by Madam Marie Sock, female presidential candidate of the Gambia, Ndeye Mariam Jan, founder of Ndure Foundation, and Dr. Mariam Jaumbo, a medical doctor at Edward Francis Small Teaching Hospital. Unfortunately, we did advertise and say Mr. Modunjai from the Ministry of Health would be joining us, but due to connection issues, we couldn't get through to him. So we'll go ahead with the show and hopefully we'll have Mr. Njai on the show in the coming weeks to kind of answer some of the questions that I know a lot of us have to pose to the Ministry of Health. So ladies and gentlemen, welcome to Stories from the Continent. Thank you so much for joining us.
Thank you. Thank you for having us. Thank you.
You're very welcome. So let's go to Dr. Mbo first. Half of maternal deaths in the world, 50% happen in Africa. In the case of the Gambia, we have seen an increase in the reporting of maternal mortality. Some people are saying there is an increase in the number of women dying. We're unable to clarify that. And I'm hoping you have some reliable data to tell us what is actually happening. But at least from what we have seen, there is an increase in the number of reports of maternal deaths. You're the expert, you work at one of the main hospitals in the Gambia. How would you assess the current state of maternal deaths and mortality in the country?
Thank you so much, Haddy, for having me. Yeah, I am here basically to talk to the public by virtue of my association with the Ndeye Mariam Jan Foundation regarding the awareness we've been raising currently. But as you have mentioned, Gambia, it's ranked as one of the countries with high MM rate in sub-Saharan Africa. However, recently we've seen a lot of reporting being done mostly on social media, but from the data we have, the numbers are not increasing in the Gambia. since 1990, the Gambia have made considerable progress when it comes to reducing the number of maternal deaths. Although we're yet to get to zero numbers, but a lot has been done with regards to this. I think when it comes to the recent campaigns on social media, it's like the public, they're just becoming aware, or they're just trying to be involved. But as I always say, maternal health is an issue for everyone, and all the time we'll be talking about it. But recently, because of a lot certain happenings regarding care for some women who unfortunately die, so a lot of like it made a lot of people to start talking about the topic. But from the official data, Gambia is doing well. The numbers are going down. But as far as I'm concerned, any woman who dies due to childbirth, it needs to be scrutinized, because like most of these deaths, they are preventable deaths. Mm-hmm. And the responsibility does not only lie in the healthcare sector, but like when it comes to preventing maternal deaths, mm-hmm. the preventive measures, they need to start from the communities, like the social factors. Like when in the case of Gambia and most of these African countries, it is the social determinants of health, the social factors, which are like contributing more to death than even the deaths in the hospital. So we need to know that like every individual, they have a role to play, from the women, the people in the communities, the society, the men, everyone has a role to play. Government has a role to play. The mm-hmm. healthcare sector, they have a role to play. But it is not only the responsibility of the healthcare providers, because they are the last people in the chain. Mm-hmm. So it is important for the people to know this. Mm-hmm. So in a nutshell, it is important to know that like the numbers are not increasing. The mm-hmm. Gambia is doing well when it comes to like maternal mortality. So we're doing what? We're doing relatively okay.
Okay, so Dr. Mbow says the numbers are actually not increasing and the Gambia is doing well. Madam Sok, you're you're a female running for office in the Gambia, one of the first females running for office in the Gambia. And with the elections fast approaching, I think Gambia and its people, especially women, are anxious to know what type of women we will have, leader we will have. And for women, I think the number one priority right now is our health. So tell us a little bit about your thoughts on the campaign that has been launched now online for the reduction of maternal mortality, and the theme being Gambian Women's Lives Matter.
Well, the theme being Gambian Women's Life Matter, I feel that all lives matter, regardless whether you're a woman or a child, because you're also bringing a child into the world, and that child's lives matter as well. And the reason why I think they say the Gambian women life matter, we are in the 21st century, and I don't think anyone should have fear to give birth to a child. You know, pregnancy, when a woman is pregnant, it's a joy to the whole family. It's supposed to be a blessing. But unfortunately, in the Gambia recently, it's a fear, you know, it's putting a lot of fear in the hearts of women. So that also creates stress. And the moment as a pregnant woman, you're stressed, carrying a child and thinking about your childbirth, which is supposed to be something to celebrate, that can affect you and the baby, because your whole hormones will be stressed out. So you probably already going to the hospital stressed out. And unfortunately, even though the doctor is saying that, you know, Gambia is doing well, I think we still have a lot of work to do. I think we need to accelerate on training for our nurses and doctors, especially in the OBGYN area. We need specialized, how do you call it, gynecologists. You know, we need prenatal care. A lot of women don't get proper prenatal care. And we need to start asking questions. What is causing all this death? You have, how do you call it, cases of female, you know, FGM, and the cause of death for that, women, you know, for example, in the provinces, why are they dying or bleeding? I heard people bleeding after, you know, giving birth, which is postpartum. So we need to find out why are these things happening, and whether the nurses or the doctors that is seeing them prior to delivery, which is the prenatal care, whether they know these things. Are they asking the right questions? Are they asking these, how do you call it, this pregnant woman, you know, all these questions, and preparing them for birth? And I think that alone can eliminate a lot of deaths as well, or mishaps along the way. And also our nurses and doctors out there, especially the nurses, how qualified are they to handle pregnancies? I know we have midwives and stuff like that, but how prepared are they? And how, because listen, if you're pregnant and you go to the hospital and you're about to give birth, the last thing you need is a nurse with an attitude. The last thing you need is someone not caring about you, because you're not only caring about one life, it's 2 lives or 3 lives. You might be carrying twins. So you having just that stress of going through the hospitals and all that can create an internal stress for you and the baby. And I don't know if we understand in the Gambia about postpartum depression or postpartum effects after you have the child, what can happen to you. You know, and these are all the reasons why I say we need to start having women in strategic places, in government, in office, so that all these things can be addressed. Because we cannot lose life just because we want to give birth or have children. You know, most of these people cannot afford to travel abroad. What are we going to do to change that? And what we need to do to change that is to, how do you call it, get more training for our nurses, get more training, have specialized nurses just for that, and specialized doctors who are specialized just for prenatal care and, you know, OBGYN. That way people know, if I go to this doctor, this is just for, you know, what we call it in the provinces, you know, just for the baby, just for the doctor for your pregnancy. Not a general practitioner or a clinic that is just a general clinic where the nurses attend a pregnant woman the same way they will attend somebody that has a car accident, you know? Because when they go to that clinic that is attending everybody, then they turn around, we cannot take care of this pregnant woman. You need to now refer the pregnant woman to the hospital. I took people to the hospitals. I took them to a clinic 2 o'clock in the morning, only to say, take that person back to the RVTH. The stress you're putting on that pregnant woman who's already dilated to have the baby, traveling in an ambulance from Bakote all the way to Banjul at 2 in the morning is already distressing for the mother and the child. It's already distressing. So you take that, by the time you go to the hospital, that mother is tired. She's dilated. And then you arrive there, you have nurses with attitude. And then the woman is just thrown there and expecting to do what? Nobody's, you know, so we have a lot to do. We have a lot of, how do you call it? Nurses have to go back to school, I think. A lot of them have to go back to school. And in the OBGYN especially, we need to have nurses that are prepared, trained, not only on how to attend to patient medically, but also when it comes to the service of how to treat these people, because these people are bringing other lives into the world. It's not just about the mother, it's about the child. Most cases, if the mother survives, the child dies. If the child survives, the mother dies. It's the 21st century. You know, you cannot take something that is so something to celebrate and turn it into you know, a stress. If you start stressing about how you're gonna have your baby, you're gonna get sick. The baby's gonna be unhealthy. Your hormones will be acting up. So these are all the issues that we need to start teaching our people to understand, and also the mothers. Who is telling them these things? Instead, they're being yelled at. I've been to a clinic where the nurse told the lady, "Oh, you didn't know about these things. You all so you don't talk like that."
Yeah.
Imagine they're telling to put the after birth. I've never heard about anything like that. And after birth, to are you serious? So now we carry our own after birth ourselves and take it where? You know? So when we talk about the how do you call it, maternity or death rate for women childbirth is how do you call it, being reduced, I don't see that. God is, we are here on lives just praying to God. God is the one that has hand in us right now. Let's be realistic, because I've been around. I am right now in the Gambia, and I take people to hospitals, I take people to clinics, and I see how it's done. And I talk to them sometimes when they come from the hospital. Some of them even they're even scared to go to the clinic. No, you have to go. Are you taking your prenatal medications? Are you taking your iron tablets? Are you taking, they're too scared.
Yeah.
Why are you scared to go to a clinic or to the hospital or to your OBGYN? Why? Because you feel that when you go, you're not being talked to properly. You're not being, treated right. That alone is, you see, that fear alone is creating a stress for you and the baby, or for that mother and child.
Absolutely. Thank you, Madam Sok, for your analysis. We'll get a little bit into some of the experiences that women face at hospitals later on. But before that, I want to bring in Mariam Jan. Mariam, your foundation is doing tremendous work to ensure that women have safe and worry-free deliveries, as they should. From your experience, what are women's experiences when they're pregnant? How are we ending up with women dying while giving birth?
Well, thank you very much, Haddy. I would just like to also, with what Mariam Jau just said about the numbers, I think right now everybody is just in this, I can say, panic mode, because now most of these maternal deaths are being brought to social media.
Right.
We started the foundation in 2012, so that is 8 years. And during this 8 years, what we try to do is, because before you can tackle a problem, you have to know what these problems are, and then what are the causes of these problems.
Right.
So we try to do as much research as we can, because I am not a medical expert, so I cannot. I just have to rely on the researches that are produced by these medical experts. And then if we talk about numbers, we can only talk about numbers when we talk about these researches. And the Gambia, actually, we cannot actually say that this year the rate of women dying is higher than the years prior, because we have not yet had we don't have the figures yet to be able to compare it. So we need to have the figures yet before we can compare it. But then what we do know that is that Gambia's maternal mortality rate now stands at 597. When you quote the number you quote in the beginning, Haddy, you said it was in 2005, it was 1,000 something. 1, so you can see that there has been a little bit of a decrease of that number. So in a way, I think what Dr. Mariam was saying was that decrease in the number. But we also have to know that still now 597 is way too high. I live in Switzerland, and in Switzerland, the ratio is 4 per 100,000 live births. When you compare this to 597 per 100,000 live births, it's too much. And I always say that even if one woman dies in pregnancy-related complication, it is one woman too much. So for us, what we try to help in is because the issue of maternal mortality is very huge. And sometimes even if you want to do something to help, I mean, it can be a bit intimidating, because there are so many factors that contribute to it. We like Madam Sok did say, the healthcare workers, negligence is everywhere. But then the reason we have less negligence in Europe compared to maybe like if we are comparing it to some other countries, it's because it all has to do with accountability. If people are held accountable, we have certain, because I mean, if you do certain things and then you know that you would not only lose your license, but the hospital will also have a problem, then you will be more careful in doing so next time. And when I went with the foundation, when we go to these hospitals to do our fact finding to know where we can come in to help, I have met so many healthcare providers that are very good, that are doing a great job, even going beyond what they are supposed to do.
Yes.
I have seen healthcare providers, midwives, they don't have surgical gloves sometimes. And these midwives will be required to go in to help these patients, putting their own health at risk because you are not protected enough and might even get something from that woman, but then they would just prefer to do that to save the women's life. I know there are many rotten healthcare workers out there, but I do know that there are also many that are going beyond their line of duties to make sure that they just try to save these women. And Madam Sogdin also mentioned about training these nurses. I think this it's deeper than just training these nurses, and then it's deeper than the nurses and the doctors. The nurses are working for the ministry. If your people are not behaving right, if they are not trained right, and you as the employer is allowing that to happen, that means that then you are not taking the responsibility and then the accountability that you are supposed to take. So I think that the social, it's not a one way thing. It has a lot of components.
Absolutely.
It starts with us, because I believe that we are all on the same page with the doctors and the healthcare workers. I always say that I don't think that any doctor would go to school for like 7 years just then to not want to save lives. If that happens, there must be something that happened along that way. And for us to be able to help, we have to also hold ourselves accountable first. Are we going to, because as a woman, if you're in, and that is where the foundation comes in.
Yes.
We cannot do certain, what we can do is we can, have sensitization, try to sensitize people, try to raise awareness. We can also go to the hospitals, because you go to hospitals sometimes, you find out that you would find only one blood pressure machine working. No matter what expertise you have, no matter how good a doctor you are, if the environment that you're working with, you don't even have the basic tools, that you need to work with, you cannot produce the results that you have to produce. So, and then I'm sure as the program goes further, we can also go into the social issues. So maternal mortality in the Gambia, there are so many components that needs to be looked at. And everyone has an individual role to play. Every individual has a role to play. And for us, the foundation, that is what we try to do is just, raise awareness. Like in December, we also started something like we provide solar powered boreholes to some of, we started with a community called Kandonku. And we expect that these women would use it because, it would make their lives easier, because women are tasked with fetching these waters. And then they also have their vegetable gardens. So the plan is that if they are using this to facilitate what they are doing, that would bring them at least a little bit of economic empowerment, because economic empowerment is also very important when we want to fight maternal mortality. There are many women, before they could go to their prenatal visits, you have to ask your husband to give you maybe the fare to go.
Absolutely.
And if the husband says, I'm not having anything today, you can't go. So you see, there are so many issues that contributes to this thing in the Gambia.
Thank you, Ndure Mariam. Thank you, ladies. I think from what Dr. Mbow has said, and then Mariam, we've kind of established that maternal mortality is actually decreasing according to them, and the statistics in the Gambia are good. They do need to improve, but they're not.
They're not good, but
they do need to improve, but they're not increasing. Yeah. And I think Dr. Mbow has kind of touched on this a little bit, that social media has a part to play, and maybe people are panicking. And this is where I really needed the ministry to really add their voice to this conversation and tell us about how much information they're putting out, and if they're effectively communicating to the public about the current state and reassuring them enough to avoid misinformation and also scaremongering. If cases aren't actually increasing and things are under control, then I think we should be hearing from them. Now we'll move on to the human element and some of the experiences that women are facing while giving birth. Dr. Zhao, can you tell us about the treatment or mistreatment of pregnant women in hospitals from your perspective as a health worker?
Well, before we even go to that, to the hospital, I'll first of all want to start with what happens in the communities and all that, for the people to understand that when it comes to maternal mortality, we have the certain determinants and correlates which affect the health of women. When we come to, we can divide this into 5 categories. The first one, I'll say the household and the communities. Like the household, the women there, like they're not decision makers due to poverty, poor income, like where they're living conditions, etc. And some of these cultural beliefs, like we have certain cultural beliefs, like pregnancy is just for women. Men should not be involved in pregnancy, in issues related to pregnancy, for example. Pregnancies are left entirely to the old women. You know, the old women, they believe that they are the experts. And due to that, like some of these old women, what they do, like when a woman is pregnant, they want to gauge complications based on previous pregnancies. And each pregnancy is different. And we have this other problem. I don't know whether it's a cultural issue or like Gambian women, they don't like to plan their pregnancies. All the pregnancies, like they happen by chance, but not by choice. So when it comes to pregnancy, well, we say it's a normal physiologic state, but it's important to plan pregnancies. Gambia planning pregnancy, it's like a dream. So the planning is very important. And when they get pregnant, instead of starting the antenatal care, what do? They want to hide from everyone that they are pregnant. Well, you can hide from the community that you're pregnant, but don't hide from your care provider, because you don't find the pregnancy. There was no screening done to see whether there are any existing underlying conditions, whether there is anemia and all that. Then what happens? Then from there, they hide before they start the antenatal care. It's very late. Gambia, when it comes to antenatal care attendance, it's very high, but we'll come to some of these things later. Regarding those social factors, as we've mentioned, like women are not economically empowered. This really disturbs them. They cannot just get up and go to the hospital, or they cannot get like certain foods that they need. And Gambia, we have certain taboos around food and pregnancy. So they'll be like, pregnant women should not eat this, they should not eat that. So all these things, they are contributing factors. And then we have like the biological factors and also some demographic factors. Gambia, we have like, I want to say we have a low literacy rate, but like most of our women, even if they're educated, some of these cultural practices, they influence them a lot. Yeah. So they influence them a lot. And they're not that aware when it comes to like their reproductive health rights and all that. They don't feel it is very important for them to understand certain things about their bodies. The other issues are like some people, they have some underlying health issues due to genetic or other factors, for example, if a parent, like if my mother, for example, happen to have a condition, a hypertensive condition during pregnancy called preeclampsia, there is risk that I could have similar condition, but we have to know that, like my mom, she had that condition, so that like if the doctors know about that, they can give certain medications to prevent complications from arising. But in Gambia, most of these things, they don't happen. So it is very difficult. The other thing that I want to touch on, we have like some people, they have certain risk factors, others don't have. So people with certain risk factors, they tend to have worse outcomes. For example, someone with diabetes, the diabetes is not managed adequately. Someone with anemia, the anemia is not treated properly. Their risk of dying whilst pregnant is higher than someone who is not sick. So the public, they have to know all this. So the social factors around maternal health, they're more important than what happens at the hospitals. Our people, they need to understand this. The other thing is issue of malnutrition and certain infections. Like in the Gambia, we know anemia is a very big problem, and mostly women are affected due to like our menstruation and all that. We lose blood, and mostly we are iron deficient. So those anemias, they need to be corrected before like pregnancy occurs. But if they're not corrected and like the woman gets pregnant, the needs during pregnancy, they increases because now there are two lives. So if those are not corrected before, the chances of the woman dying at birth, it's very high. We have issues of protein malnutrition in Gambia. We have some issues with protein malnutrition. And now I think it's even going to get worse with this COVID. Always I'm hearing people complaining about fish. It's not available and all that. Agriculture, we don't produce enough. And all these things, they're related to maternal health, because the women, they need to eat healthy. Everyone in society need to eat healthy. But women, they need to, because of like pregnancy and the good nutrition and the effects it has on pregnancy. Malaria, in some areas, it is a problem, but Gambia, malaria is not an issue in pregnancy, because we give like prophylaxis to the pregnant women. Everyone is given prophylaxis, and like some vaccines are given, especially the tetanus vaccine. So in the Gambia, these are not issues. Malaria and tetanus in the neonates, they are not an issue, because we are able to do very well regarding those things. And screening for HIV, we're doing very well. And all these services, the women receive them at no cost. Like I'll say like the pregnant women, the services they receive at the hospital is free. And there's nothing like free healthcare. Someone has to pay for this. So if we want quality service, someone really has to pay, whether it's government, whether it's from the individuals, but someone has to pay. But the Gambia, it's free, but the hospitals, like they're really suffering, the public hospitals, because like they're not receiving enough for that. So the public, they need to know about this. So then we have like health system factors which contributes to maternal mortality. It has to do with the skilled staff, availability of equipment, blood. Like in the Gambia, we have a blood bank, but when it comes to donating blood, it's a very big problem. And I've seen like people on social media even like trying to say that like anytime we go to the hospitals, we don't have blood. Blood is not manufactured. Blood is donated. We rely on voluntary donors, and most of the times people don't donate voluntarily in the Gambia. It is a very big issue. We have our banks, but they're always empty. Even our foundation, sometimes we engage in blood donation drives to get blood for the hospitals. So if the blood is not available, and most of the times, like men, they're not that actively involved. The bad companions are mostly these elderly women. You send elderly women to the hospital, they don't have a phone, or they don't even know numbers to call. It's really very tedious sometimes. And sometimes, like, I can remember there was a day I was in OBGYN. One of my colleagues in the surgical department, he had to prepare a patient for surgery, got the blood and all that. But we had a woman who was bleeding in OBGYN. We couldn't find blood. I went to the blood bank and adhered the blood for that woman to be donated. And then after my colleague, he came after me, and you know, it was difficult. And these things are still happening. Like, we'll be taking other people's blood, and sometimes it's really difficult. Some of the people, they will come and donate, and if we don't give it to the patients, they will say, "Give me back my blood. For me to even pour it is even better than me leaving my blood here." Can you imagine? All these things happen. Like, in our hospital, sometimes, like, the care we have to give our patients, like, it's the logistics most of the time that takes a lot of our time. The resources are not there. Like, so it's really difficult. And sometimes it's not that, like, we have the people who are very hardworking, who are qualified, because, like, we have the University of the Gambia, it's producing people, like, very good graduates, like, who have been to, like, industrialized countries, and they are doing very well. And, you know, we go through a very rigorous training in the Gambia. So ask anyone. I love the Gambia to come into an industrialized country, but it's easy for me to study and all that because of the training that we received in the Gambia. And we have the people, like, the numbers are not adequate, but we have people who are very dedicated to their work.
Okay.
It's true. Yeah,
Thank you.
Also, like, the other is national policies. We have to talk about national policies when it comes to government.
We will get into the policies a little bit later on, Dr. Mbo. Thank you for all the points you've raised. Really interesting things you've said. But what I really want us to address is an issue that has been raised over and over again on social media on how poorly pregnant women are being treated by health workers. And you know, this is in no way an attack on any health worker. We think, you know, like you've said, they've all done incredibly well. We have trained health workers, especially during COVID-19. A lot of them have risked their lives and been on the front line to help the public. But Marie, I'm going to bring you in now, Madam Sok. What programs should we have? How can we address this issue that can target health workers, managers, supervisors in hospitals to take accountability?
Can I come in before? Oh, sorry.
Can you let Madam Sok speak, please? Yeah.
Yeah, sure.
Thank you, Dr. Mbo.
Yeah, hello. Yes. Well, I will go back a while ago when we had better, probably we didn't have better healthcare system, but I want to say that the prenatal system was much better. I remember, you know, when I listened to Dr. Mbo, she's talking about poor, diet, or patients, pregnant women dying of or having issues with diabetes without the doctors knowing. That is what you get. That is what is, when you go, for example, as a pregnant woman to your clinic, the first thing your clinic has to do is find out what your ailments are. What are you allergic to? What are you not allergic to? Whether you have diabetes, and these things, we used to have that. We used to have clinics, even, for example, the Westfield Clinic back in the day, they used to have all that, where you go and they would give you advice on the things that you're supposed to eat, your diet and everything. I mean, I just want to ask what happened along the way, because all that existed. Gambia was producing healthy babies. Gambia was producing healthy mothers and babies. My mom, like I tell people, was a nutritionist. You know, you don't need to necessarily, when you make, for example, churragate and stuff like that, that's very healthy for babies. There's a lot of nutritional things that we can eat locally that can help our babies. Now, I think it is the how do you call it, the healthcare workers that are not really, some of them, not all. There are really a lot of healthcare workers out there that are bending over backwards and doing their best to take care of these patients. But of course, they're limited. If you go to the hospital right now, a lot of things are not available. You know, I mean, before a nurse is taking her finger and inserting in, you know, the uterus of a woman to feel the baby, you know, or when you go as a, you know, to your OBGYN, they don't have the tools to even check you properly. So you are in a lot of pain because they don't have the tools. Our nurses, our doctors don't have the tools that they need to do their work properly. And I understand that. You also have clinics that are not doing their job. You have a lot of private clinics that are calling these women to go there, but then when it's time to give a birth, they refer them back to the hospital. So these are all the things that we need to look at and separate these things. If you, as a clinic, decide to take up a patient, then you need to make sure that patient is taken care of from day one to the time that they give birth. Internationally, when you go to a clinic and a doctor takes care of you, it's that same doctor that goes to that hospital on your date of birth to make sure he is present when you're giving birth. Not you going to the hospital and another doctor taking care of you that has zero history of your whole, how do you call it, pregnancy. You know, a pregnancy has a history from your prenatal to when you give birth and then postpartum. We don't have that. Here you go to a clinic, they cannot take care of you. Last minute, they will refer you to the hospital. You go to the hospital, there's no track record, there's no history. And then your doctor that was taking care of you day one is not there anymore, you know, or is not there with you. So you're now having a whole new doctor, a whole new people taking care of something that they don't even know about. So how will they know that you have diabetes or you have something when, like I said, I took someone to the hospital, they brought the person with an ambulance. I asked the doctor, okay, where's the paperwork? He said they brought the person with no paperwork. So if they brought that person with no paperwork from that clinic, who are we supposed to hold accountable? We're supposed to hold that clinic accountable. You know, you don't treat a patient and then refer the patient when you know you cannot to another hospital and then don't give them any track record or history of what is wrong with that person. So there's a lot of things, you know, like it's nice to sit here and say, okay, we have less death rates right now. We had 1,000 in 2000, what was it again, 2017 or 2007? What was it? Was it 2007?
2005.
2005.
Yeah.
2005 to 2020. 2020. You're talking about we only reduced only 50% of the death rate. I mean, that is still shocking to me. We are in the 21st century. No woman should die of childbirth. You understand? So you cannot be comfortable saying, oh, we had 1,000 and now we have only 500 after how many years? You understand? Right now, we should be improving, not going backwards. We should be proud and say that every child is being born healthy. In the 80s, late 80s, early 90s, we didn't have these issues. You know, people go to the hospital, you go to a clinic, you have a card, your prenatal doctor will tell you what to take. You'll get your medications, you get everything, how to eat. People that come and they don't know what to eat, how to eat. Even when you're sick, I've seen patients where they are sick and they come and they say, I cannot eat anything. They'll prescribe for them. We had people that cared. Sometimes it's not even about much of, okay, I'm qualified in this field. It's also caring for these people. You know, we have a lot to do as far as training, going back to the drawing board, also making sure that prenatal care is given. When we say prenatal care doesn't just mean giving medications to no, prenatal care meaning finding out what is wrong with this person, whether they have an existing condition, whether they have diabetes. That is what prenatal care is. Because anyone can get pregnant. We can sit here and blame it on, oh, they're not using, contraceptives or whatever. But this is all part of the prenatal education. This is what they get when they go to prenatal care. The doctor will ask you how many children you have. Have you ever had any children before? This is your first child. Have you been circumcised? Yes. Have you never been? You understand? These are all things that are taken care of in your prenatal care. You know, and then the doctor can have, all the history of who you are, what you are, the ailments you have, and then know how to take care of you from that time to giving birth.
Marie,
what I see,
I'm going to stop you there, Madam Sok. And what I also want to know from you before we move on to Ndeye Mariam is, what do you plan to do about this? You know, I think we've seen that women in general feel like they're not heard by not only the government, to be fair, but people put into those places of power. The right policies are not there to empower and protect women. What do you plan to do about this?
Well, if you hear from what I've been saying, what I've been talking about, these are part of what's going to be implemented, because I feel that every practitioner that is calling themselves an OBGYN, you know, a gynecologist, and a pregnant woman comes to you or a clinic, then you should be able to go through these policies and make sure that these people are taken care of from day one to the time they give birth. And until we have this kind of policies and making people accountable for their actions, we are not going to get better. We're going to sit here in the next 10, 20 years and talk about, well, 10, 15 years ago, we only had 500. Now we only had 250. You understand? So we don't want that. We want to talk about, oh, we have 1 in every 2 million. Even that should not happen, but we should come to that, because we are in this, how do you call it? Like I said, we're in a generation right now, people don't die of childbirth, you know, but are the doctors being held accountable? Are the nurses that are taking care of them being held accountable? Are the hospitals or clinics being held accountable? No one's being held accountable. Everybody's doing, like I said, clinics are taking care of pregnant women that have no license or anything to do any work as far as a OBGYN. But they'll take care of these patients, make them pay some money and everything, then at the end, refer them to the main hospital. Then we need to cater, we need to have a system where the main hospital is empowered enough to have a section just for that. So we will have to put in some strict policies which can empower women to give birth properly and know that when they get pregnant, there's no fear. The fear of getting pregnant in Gambia alone can stress you for your baby to die or you to lose your life. I mean, what are we talking about? I don't sugarcoat things and try to make things like it is not as serious as it is. I've been on ground. I've been with people where they're holding my hand and crying and telling me, if I die, take care of my other kids. Until that happens, until you witness that, you will not be so calm about it, you know?
So a continuum of care and also putting in the right policies to protect women.
Putting in the right policies to protect women, putting the right policies also to protect the baby. It's not only the woman, it's the baby and child, it's the mother and child. Absolutely. Sometimes even the child is gone, you know? Now, also putting in policies that clinics that are not supposed to take in pregnant women, you have to have the qualifications or have staff on board that are qualified to do that. Because you cannot take on a pregnant woman as you are taking on somebody that has accident in the street. And then when you realize that the woman is dilated and is supposed to have the baby, refer them now to the main hospital after they've paid all that money. You know? So there's a lot of things that need to be corrected. And I hold our healthcare institution accountable for that. I am holding the healthcare institution accountable for that, because that is from our healthcare institution. They need to hold these clinics and hospitals accountable, and also make sure our hospital is well equipped, especially for the maternal ward.
Thank you.
And make sure also these clinics are well equipped, and the doctors and nurses, because like she said, if the doctors and nurses don't have the tools to do their work, yes, it's going to limit them. It's going to make their work harder. That's fact. So there's a lot of issues. It's not just about the woman getting pregnant. It's about the woman getting pregnant. It's about the woman having the right, gynecologist or caregiver or caretaker to tell her or ask her certain questions. If they're from the provinces, obviously they don't even know if they have diabetes. They don't even know if they're allergic to certain medications. Here I see pregnant women being given certain medications that can harm the baby. If you have malaria, they have to give you, chloroquine, or chloroquine can be harmful to the baby. And then you're talking about dosage, you know? I've seen pregnant women taking the most, dangerous drugs that can have a big impact on why they lose the baby or why they are having or they hemorrhage after giving birth.
Mm-hmm.
Because they're giving them medications that they're not supposed to give them whilst pregnant.
Mm-hmm. Mm-hmm.
During pregnancy, I'm shocked. I sometimes look at this. I have people come to me, I say, you don't drink this.
Mm-hmm.
Don't drink that.
Mm-hmm.
I say, you're pregnant, you cannot drink this. I will go on Google and Google it. I say, you see, it says not for pregnant women.
Mm-hmm.
I'm not talking, I might not be a medical doctor or anything, but come on, I've given birth, I have 3 kids.
Mm-hmm.
And I've been on ground and I see people who look up to me to help them when that time comes.
Thank you, Madam Scott. Now I'm gonna let's move on now.
And these are the issues why today you see the social media is pounding on women's lives matter and all these things, because these are issues that are not being addressed. Yes, maybe it has to come to social media for people to start acting, because apparently now things have to come to social media for people to really turn around and say, hey, you know what? Let us really look at why our women are dying. But it doesn't have to be so.
Thank you, Madam Sok. Let's talk a little bit now about the health needs of women. What type of commitment are we seeing, not only from the government, but I think it's important that for this to be a joint effort and include other sectors. I think all sectors have a part to play to ensure that women are not only not dying when they're giving birth, but also have the necessary healthcare they need for things like contraception, smear tests, etc. Because our health needs, I'm sure you'll agree, Dr. Mbo, are very different and sometimes more complex from what men need. Dr. Mbo, would you like to come in?
Thank you for that. Well, before I go to that comment, I just want to make one clarification. Madam Sok, we need to be very careful with the information we give to the people out there, especially when they come about the healthcare problem to you. I think the best thing that could be done is to try to link with the provider and explain some of your concerns. Because when it comes to this issue of coming to social media, I think the Gambian people, they don't like using the right channels, because if something happens at the hospital, we have the public relations office. The people should be able to go to those offices and lodge complaints. And I want to tell the people that chloroquine is very safe in pregnancy. It is safe and it could be used. So we need to be very careful, like when we're given advice, if it is not evidence-based. So this is why
well, Dr. Mbo, if you say chloroquine is safe and somebody is taking the dosage, I said something. I didn't just say chloroquine is not safe. I said the dosage of how they're giving them the chloroquine.
I don't want us to be prolonging, but like, since we are like talking to the public, I want them to get the right information, the right message. It's important. So this is why I'm even at the foundation, evidence-based is very important to us. Like, they could have done their work without calling doctors and all that. But because like we know the nitty-gritty, so it's important for us to clear some of these things to the public. Like, if you have any concerns about a particular healthcare provider, the best thing is to discuss with them. As healthcare providers, our role is not to impose anything on anyone. We're there to give advice and help our clients to choose the best options for them. We have to understand this, like there's something called autonomy. So it is very important. Let us try, as far as we try to raise awareness, but we should not try to put doubts in the mind of the people. Because
absolutely.
Like,
we're not trying to put doubts. If you, doctor, we're not trying to put doubts. Hold on a second. What the lady was asking, give me a moment. What the lady was asking was, why is it on social media that we are talking about people, like women, going through what they're going? It is on social media.
Can I just please come in for a bit before Dr. Mbo continues?
Yes, go ahead, Mariam, please.
So I just wanted to also make some clarification that when we talk about the figures, we are not downplaying anything. But if we want to be taken seriously in this fight against to reduce the rate of maternal mortality, One important aspect is research is very important, because we can sit here and say, you know, the amount, the numbers are going up and all that. But then if we don't have the research to back this thing up, then we will not be taken seriously. And then Madam Sok, sorry, I'm saying Dr. Sok. Madam Sok did mention that in the 90s, you know, things were better. You know, they you know, they had this. People were not that. But then the thing is, actually, in the 90s, the amount of women that were dying are actually more than we have now. And I always say this: the reason that, for example, we started this foundation was because the issue of maternal mortality is something that is dear to, you know, that is, we are very passionate about. My husband lost his mother. I know people that are close to me that, you know, I know people that lost their lives through this. So I think the reason we are doing this is to actually help to reduce the rate. We feel that even if one woman dies, you know, that is one woman too much. But then that does not mean that we should not also look at the research to show that, you know, it's actually going, you know, it's actually going down. But then even though it's actually going down, we're not like, it's not something that we're celebrating, because we feel that we still have the highest maternal mortality rate, one of the highest in sub-Saharan Africa. In fact, in other sub-Saharan African countries, the ratio is 424 or something like that, and we are up to 597. So this is indeed a big problem. But just to clarify that we are not downplaying the numbers. We feel that the numbers are too much, and this is why we have been doing this thing.
Yeah. Okay, thank you, Ndeye Mariam. I'm going to come back to you again, and I want us to move on. I feel like we're going back and forth a little bit too much. Let's talk about the role of men in women's health. So, you know, I think they have a very important role to play, and sometimes it's as simple as accompanying your partner to hospital appointments, supporting them with diet and exercise. How do we ensure that men are part of the solution, Ndeye Mariam?
The first thing is to sensitize people, because people cannot, you know, people should know. We have this cultural problem that pregnancy is just for the women. Men do not give, you know, they don't get involved in anything that has to do with the, you know, the woman. And then even when you look at it, when growing up, if you're a young woman, as you grow up, the men in our lives, even like our fathers and in Gambia, you know, everything that has to do with the girl child, it's the mother.
Absolutely. You
know, when they don't even know anything. And I think that if you have a daughter, there's a, you know, I mean, you should be involved. It's there. So men are not involved. It's a cultural thing where men are not that involved in these kind of things. Even when it comes to taking your wife to the clinics, men do not, you know, it's just left to the mother-in-law.
Because I heard what you said earlier. You said women need, you know, when they need to go to the clinic, they ask the husbands for money to go. And I'm thinking, surely this should be something that they should attend together, so they're aware of the situation and part of the solutions from the early stages.
No, they don't. Let me come in a little bit there. Let me come in a little bit there, Haddy Ndure. You know, I don't know. I am in the Gambia. Okay, I am in the Gambia, and I don't think any of you are in the Gambia. And I've seen a lot of men accompany their wives to the hospital to the point where they get frustrated. You know, I see how, because you have to understand also that men cannot handle when it comes to women, when it comes to childbirth. But I've seen a lot of men go with their wives. Actually, men will be running helter-skelter or crazy. When are you talking about the married man or the boyfriend? Do you understand what I'm saying? So I'm just trying to clarify, because we cannot sit here and down and say men don't. Hold on one second, or men don't. I do see men that have gone to the hospital with their wives, because at the end of the day, they even have to run and buy the medication. They run and go and get this. They run to do this. I've seen a lot of that, you know, in the hospital. I'm on ground and I go and I see this.
That is true, because some maybe my state was general, but I can see that, you know, the Gambia goes further than the Greater Banjul area. And yes, we are not in Gambia, but I usually come to Gambia every 6 months, and we have people, you know, the foundation members that are on the ground. We have midwives that are part of the foundation that and then whatever thing that the foundation works on, we also have to do some fact findings before. So we do know, and we do know some of these things on the ground. Next week, we are starting an awareness raising campaign in communities that could not, so that to get to people that are not on social media, that could not access our online campaigns. And one of the things that we are going to do is we have a midwife that would be going into these communities, that would be talking to the men, and then would also be talking to the women on sensitizing them about the importance of prenatal cares, and then the importance of men giving companionship to these women. But when you go to, especially in the rural areas, you don't have men that are, even in the urban areas, I know men that go with their wives. Yes. But just because I know these men that go with their wives does not mean that a lot of men are that involved. And I always say, this is why, these researches are very important, because we can sit here, I can say, a lot of men do, don't go, a lot of men do not go. But then in the hospitals, and then the people that work in the hospitals, I went to Bundung Health Center, was it last year or in December? And then one of the things that the programs they have is like men's clinic, where they encourage the men. Now, if men were coming as they were supposed to come, I don't think that this would have been a problem that would need addressing.
Yes. So, thank you, Mary. I think what we're trying to establish, or at least from my end, is that men need to be part of the solution, and we need to include men in the solution. We're not in any way saying that men are not accompanying women to the clinic, but we're saying that if they're not, then they should.
Exactly. So yeah, we need them. This is a fact for everyone.
So moving on now, is it fair to say that women themselves do not prioritize taking care of themselves and their pregnancies? Because I've seen comments like that. Dr. Mbo, do you want to come in now?
I want to say, as I've said earlier on, like most pregnancies in the Gambia, they happen whilst they are not planned. So if at all, like, they really cared that much, they would have like planned those pregnancies. But like when it comes to the literacy level also, the literacy level is very low. The Gambia, the health-seeking behaviors are also very bad. Like people, like when they're sick or they need something at the health facilities, they stay very long, or they will try other means before they go to the health facilities. So when it comes to planning pregnancies, that does not happen. A lot of women also, they don't like taking their supplements. Like when it comes to like taking the folic acid or the iron tablets, they will say it gives them side effects and all that. We try to advise them to take it before going to bed, so that it will not give them a lot of side effects. But generally, some of them, well, some will take, but there is a lot who does not take. And also when it comes to like advising them regarding certain things, like for example, a woman, the first delivery, it's cesarean delivery, and you advise them that you need to plan your pregnancies to do a conception counseling and care. They will not, you will not see them, you will lose them to follow up. They will never come back again. So because they're so worried, you talk to them, you try to communicate. Sometimes we have issues of communication and all that, but like the women, they're not so much in control. Like most of the decisions, the men make the decisions. When it comes to contraception usage, you talk to them, some of them will be like, they have to take permission from their husbands, or when you want to do certain procedures for them at the hospital, they would like rather prefer, especially the ones who are not educated, they would rather prefer to wait for the husband or call someone to make those decisions on behalf of them. So in trying to solve these issues, women need to be educated. They need to know what it means, the importance of taking care of themselves, getting proper diet, proper nutrition, being able to plan their pregnancies, being able to make like decisions about their lives. It's very important. Because to be honest, what I see practicing in the Gambia and on social media and everywhere, women are not that empowered in the Gambia. We need to be empowered. We need to make decisions about our lives. We need to lead. Yeah.
Yes.
And
There's someone just commented on Facebook saying this should start in schools, teach anatomy and biology, then men and women can have the midwives come and talk to the communities. And I totally agree. I think this is, like I said in the beginning, it should be a comprehensive approach. It should be a holistic approach. It's a comprehensive package that should come from all the different sectors involved, and education, as always, has a huge role to play in it. Now, Madam Sok, I'm going to bring you in again. One of the debates that have emerged this week is from the draft constitution being written off by Parliament, is the amount of money spent to produce that document. Now, I totally agree that this is one of the most important pieces of legislature necessary to move a country forward. But when we look at the issue of spending in government and where the money is going, is enough being invested in healthcare, and in particular women's health? Madam Sok.
Well, when you look at the situation right now, I think that explains itself already. Where during the COVID-19 and everything was centered around COVID, I think probably that's why they even forgot that there were other ailments, and they forgot that there were other issues or health, issues or health problems in the Gambia, because they were so concentrated on that. Gambia is getting so much money and aid, and I think our healthcare sector should really be prioritized, you know, in every aspect. Then we would have been ready on time for even COVID. If you look at the amounts of monies that came in and what it was spent on, I'm sitting here, the young lady was talking about Gambia is bigger than just Greater Banjul. I don't spend most of my time in Greater Banjul. I spend most of my time in the provinces, you know, where you have a lot of pregnant women or women going through prenatal, through their prenatal times, and there's no one there to take care of them or help them out. Or there's no doctors, and only, especially during this COVID-19. And, you know, it's like they were completely neglected. So they have no choice when they want to give birth to try to travel from the provinces all the way here, or give birth in their houses, or try to find a family member in the city where they can stay. So these are a lot of challenges that are on ground. We can sit here all day and talk about statistics and all that, but I go by what I see on ground. Like I said, I'm not a doctor, I'm not an OBGYN, but some of the things that even doctor pointed out, these are things that your prenatal caregiver, you know, your doctor talks to you about, you know, like a consultation. And we need to start sensitizing people on that. So when you talk about our COVID-19 or COVID funds and all that, and how everything was neglected, even the COVID-19 or the corona was neglected, you know. Right now, people are using home remedies. People are sitting at home and doing home remedies and doing their own concoctions, you know. So if that money alone was, you know, not used properly, what makes you think that they will, you know, include when you talk about pregnant woman or prenatal issues, you know? So there's a lot of revisiting to do. Our healthcare system is failing, and is failing very, very badly. A lot of people are donating medical equipment, medical stuff, but it cannot be used properly if we don't train or help or empower our nurses and doctors in the hospital so that they can do their job properly. Today, what we see as far as COVID should have been avoided, because we had enough time, we have ample time and a lot of money to have taken care of that. But things came, PPEs came, and they all disappeared. So like I said, I don't even want to comment on the draft. I think everything is so disappointing. Especially, I just care about the areas, which is the topic of discussion right now, which is about women's health. And how we need to start putting women and women that care into strategic locations or strategic places in government that can help take care of these issues. I did mention that in the 80s and early 90s, because later in the 90s, like after the 90s, that was not in Gambia. So I don't know the mortality rate of pregnant women, but I know there was a point in time when giving birth, there was not, there was not such death rate. Or maybe I'm wrong. Like I said, I'm not a doctor and I didn't go by those statistics. All I know is that in those days when people are pregnant, time was given. They go through their prenatal care. They see their doctor. They get they get all their their medications, what they have to take. They are tested for everything. Everything was done properly. But what I see now is completely different from what was happening then. And it hurts me to see what is going on today, that we have so much money and so much effort being put in our healthcare system by individuals, concerned citizens, and still nothing is being done from our health institution to empower or enhance the help that our brothers and sisters are trying to do for our healthcare sector. And the COVID funds alone tells you a lot. So we need to, we need to regroup, come back together, stand together so that these things don't happen anymore. Come the other years, we shouldn't be talking about death rate going down or going up. We need to start saying, women don't die of childbirth in the Gambia. We need to start saying that every child should be delivered and every woman should be happy to be pregnant, or happy to give birth, not fair to give birth. So we have a lot of work to do. We are not just centralizing our thoughts and mind in Banjul. When I talk, I'm talking for the provinces.
Thank you. Thank you, now. I'm so sorry. I'm gonna have to cut you off. I'm conscious of time. We're running out of time. So my final question to you all.
Yeah, when in the provinces, as I sit here with you, the roof of a clinic flew away in the rainy season, and in that area they have over 1,900 prenatal and postpartum patients. So these are all issues that are really not being taken care of, which we on the ground know about.
Thank you, Madam Sok. So my final question to you all on improving the maternal mortality rate. According to the WHO, there are 5 midwives per every 1,000 deliveries in the Gambia. So nowhere near enough. Lack of capacity is clearly a challenge. Ndeye Mariam, I'm going to bring you in now. We all have said in the beginning the current state. How do we improve and go forward? Where should our attention be to improve the mortality rate?
Well, I think that I personally think that if we want to improve this mortality rate, we have to work hard on accountability. I personally feel that it starts that way, and hence this is the final question. I would just like to say that 2 weeks ago, a woman in Kandonko village lost her life, after she gave birth, because it took them just from the village to the main road was like 4 kilometers. They had to put that woman on a donkey cart to take her to Somita, to the main road. And from there to the clinic, they could not even have other transportation means to continue with her. By the time they got to that hospital, it was too late. So in cases like that, that is where we all have to ask ourselves this question. For that woman, how did we fail her? Before she died, before she could get to the hospital. So I feel like, this is so much more, and we have to hold each one accountable. Why should a pregnant woman have to be on a donkey cart? And this is something that keeps happening. This is not a one-off time. Why should a pregnant woman have to be put on a donkey cart in the middle of the night, 4 kilometers? And I have been to that village numerous times. I know how the roads are. I cannot imagine what that woman would have gone. So if we want to fight this thing, the first thing we have to do is accountability. We have to hold government accountable. We have to hold the healthcare workers accountable. We have to hold the communities accountable. we have, we all have to be accountable at the end of the day. I feel like if we are not accountable, then we will just be doing things, and then we will not even be able to know what we have achieved or not. So that is, for me, that is something that we all have to work on.
Accountability.
Yes.
Madam Sok, your final thoughts. How can we improve going forward?
Well, I think I've said everything that
like we said, but I want you to come in from a politics point of view and a very strategic point of view, because you're aspiring to be next president of the Gambia. So really, we need to hear from you, and also you being a woman, it's important to hear from you. You need to say this and this and this is exactly what we need to do to improve this issue.
Well, that is, like I said everything before, and it's like I'm repeating myself, but I'm going to say it again. We need to start putting women in such places so they can make decisions for us women, because, you cannot have men making decisions for us when it comes to the health sector and the health care of women and child. We also have to have strong policies put together for the medical, the medical system, for hospitals and clinics and private clinics, and also strong policies of accountability for all medical institutions in the Gambia. We have to start sensitizing the populace, sensitizing both male and female on what it is, prenatal care and stuff. All these things that I'm talking about were here before. It's just, I think over the years, there was negligence and it was all neglected. And we can bring all that back with new technology and new improvements that we see in other countries, implement that in our countries so that our healthcare system as a whole moves forward and is better, because we need to stop going to other countries and trying to cure ourselves. During the COVID, we see that a lot of people could not travel. We all had to end up going to the same hospital that we neglected. So what are we going to do about it? What we are going to do about it, the Marisa government is going to do about it, which is the Alliance of Social Democrats, is make sure that we are going to enhance our hospitals, make sure as well that we have enough clinics and hospitals in greater towns and other villages for accessibility. No one should be in a donkey cart to go over there. Her story that she said happened also 3 years ago and is still happening now. So these are the things that we need to fix when hopefully we have women in strategic places in office in the Gambia, because I don't think if we have more women in office, they want to see these things happening that are happening now. And I think strong policies, accountability, improve our health system, making sure we have accessibility to hospital from Banjul to Basse. I think that will help us a lot in improving and making sure all lives in the Gambia matter.
Thank you, Madam Sok. But what about education? What about what role do you see education playing in this? I think
I did say yes. I did say also that we need to improve and help our nurses and doctors. In other countries, nurses go always for courses. They always go back to classes and whatever, for improvement and stuff like that. And we need to now begin to categorize or have specialists, for them to specialize in certain areas. And from what I understood, somebody was saying, oh, we need to have that in classes, biology. We had biology in school. We had the female, the female organs, the male organs, all about our bodies and stuff, our body anatomy and all that. We had all that in school. And I don't know what happened. I don't know whether these are not being taught anymore. The male boys in those days can tell you about the female organs, girls can tell, we had that. And it's still happening in schools internationally. It's part of the daily classes, it's part of the curriculum. So these are the things that start in school, and also offer, nursing classes just before you graduate so that you can make a choice whether you want to be a nurse or whether you want to be so on. So that way they can continue that as a further study and then have categories and grades. You know, like I know, for example, in the US, we have CN, LPN, and RN, which is the registered nurses, and then the certified nurses, and then so forth and so on, which is the lower grade to the high grade. That way we can differentiate, you know, the levels of our nursing, because I don't know if we even have that in Gambia. All I know is we have general nurses, and this can put a lot of stress on our nurses if they are sitting there and doing everything. You know, like our nurses basically are doing everything. Our doctors are doing everything. So, and this can create a lot of stress mentally for them, you know, because the capacity is not there. You know, we're not improving. We're not improving our school system to add that or send our young doctors back to you know, internationally to study, or even have universities to do that. So all these things have to be taken care of. All these things have to be done to improve our education system. Education is key for everything. In every country that you go, the reason why they accelerate is education. That's the basis of everything. And once you have that, then the country goes. But meanwhile, we have a situation right now, and that situation there has to be fixed as well, whilst we are also fixing our education system. So yes, it is all captured in our manifesto, like I said. So I hate to always go into all that, because I'm always talking about my policies in my roadmap, which is my roadmap to making Gambia move again, because there were things that happened in my time in Gambia that were good, and I think they can still be implemented and improved on, especially in a day and age where technology is part of our lives. And these are things as well that we need to start teaching our nurses as well. And I'm sure our doctors, when they go internationally and study and come as doctors, what they use and what they see internationally is not available here. So, and whose fault is that? It is the fault of our health sector to put those machines or those technology apparatus in these hospitals so that our doctors' jobs are easy. You see a nurse doing a scan, you know, a nurse doing this. I mean, that's not, you know, they have specialists for these things, but we don't have that. So there's a lot of areas that are lacking that we need to look at. And the health sector has to have people that really understand all these areas or all these things that pertaining to health for the Gambia to move forward.
Okay, thank you very much, Madam Salk. Dr. Mbo, final question to you. More of an advice, really. I'd like you to please give a specific advice to all women listening, those expecting and those planning to have families in the future. How can we go about this in the safest way possible?
Thank you so much, Haddy. To everyone out there watching and following, what I have to say is to prevent maternal deaths, everyone has a role to play. From the individual communities, the health sector, from government. But the most important determinant is to have our women and our girls educated. Absolutely. And education is very important. Like we need to make education compulsory from like, I always used to say like from like kindergarten up to university level, it needs to be compulsory because we need, the women, they need to be educated. Like if women are educated, those societies, they tend to develop, and they develop more because like, because of our rules. So it is very important to educate women. So secondly, women need to be empowered, financially empowered. They should be able to do jobs that pays as well as men. So that is important. And when it comes to the communities, our communities, like we have to continue practicing the good cultural practices, but they're the bad ones like FGM, those ones, they need to be
left behind.
Yeah, they need to be left behind. They should not be a thing of the day. Like men needs to be involved, like in all stages of the women's life. They need to be there.
I'm sorry. What about the women planning to have families? How can they go about this in the safest way possible?
it could be done with the help of their care providers. Like they have to go do this. Like we have this concept of preconception counseling and care. Gambia, it is not, at the moment, it's not part of our policy, but it is part of policies of many different countries, and it has been shown to work. Like it works because with this preconception counseling and care, when they get to their providers, they were able to like sit down with them, discuss their histories, like do physical examinations. Like they have to do it with their husbands. Like they go to the clinic with their husbands. Detailed history is done. Physical examination is done. Some screening investigations are done. And then the women will be advised like as to how to stay healthy. Like if at all they're smoking, they have to stop smoking. If they're using alcohol, they need to stop that. If for example, if they're in a society where there is so much violence, they talk to the men to be like more loving and caring to prevent gender-based violence. Sexual and gender-based violence is very important. It's also important to, for example, there are certain environmental conditions that can affect the pregnancy and all that. These things, they need to be discussed whilst planning the pregnancy.
Yes.
It's important to discuss about drugs because certain drugs, they should not be taken whilst pregnant. So these things are very important. These are some of the things like sickle cell screening, hemoglobin, all this, to know their blood levels, their blood groups, to prepare for the pregnancy and in case they would need blood donations in the future. So these are all the things. It needs to be planned. Planning pregnancies, the evidence is very robust that it prevents maternal mortality and also neonatal mortality. So we need to think about that, like planning pregnancies. Pregnancies should not just pregnancies should not just happen by chance. They have to
need to be planned. Thank you very much, Dr. Mo, and thank you, ladies, for all your insights. I agree with most of what all of you have said. You know, and I very much see the way forward as implementing what you said, Dr. Mo, the comprehensive package. It starts from, I think, when we are girls, we should be taught about sexual health, sexual education. When you're an adult, you should be aware of access to contraception, should you need it. Pregnant women should have the proper antenatal care, prenatal care that you've just mentioned, Dr. Mbo. And also, I think data is a big thing. You know, it is, and I think in 2020 we've seen just how important data is in kind of being the starting point in solving many of the challenges we face. And I know we had a lot of back and forth between the ladies because of the lack of data. So hopefully these are all policies that will be implemented. Marie, we're looking forward to kind of seeing more of what you plan to do to help women. Dr. Mbo, thank you very much. And Mariam, thank you also for all that work that you're doing in supporting women. Thank you, ladies, and thank you everybody for watching.
Thank you very much.
Thank you, you too, and keep doing an amazing job.
Thank you.
We're proud of you.
Thank you, Dr. Mo. Thank you. Thank you all.
Thank you
very much. Thank you. Have a lovely weekend.
You too.
Bye-bye.
Okay, bye.
Hi everyone, my name is Haddy and I'm a journalist and communications specialist. I believe that as Africans, we should be in charge of every narrative coming out of Africa. We have a lot of positive stories to tell and share with the world, and I'm determined to use my platform to make that a reality. This is why I teamed up with the Fata Network to bring you a brand new show, Stories from the Continent, every Saturday at 4 p.m. Do make sure you join us. There will be lots of fun, informative and impactful conversation.